Welcome back. Well, this morning we are focusing on protecting our pets and ourselves from tick-borne diseases. Here with more details is Dr. Adam Foret from University Veterinarian Hospital. Dr. Adam, it's good to see you.
Morning.
And this is something we should definitely be concerned about because you were talking about the incident map. Where does it start and where does it go?
Yeah, so when we're looking at ticks, we're talking about ticks, they're kind of these weird, creepy, crawly little critters that we don't think about. And you don't see it, maybe say, occasionally my dog or cat has a tick on them. But you look at the incidence map of where tick-borne disease is in the area, and it starts just below Shreveport, and then it increases through Shreveport. And then as you get north of Shreveport into Arkansas, North Louisiana, it's pretty high, as far as documented cases of tick-borne disease.
And you just said documented cases, because what's scary about this is the signs and symptoms. It's kind of like silent. Talk about that.
It's pretty silent. So, an animal has a tick on them, and how long does it take to transmit the disease?
Yeah.
And so ticks are kind of different. They're things that like heartworms from mosquitoes. It's one bite, boom, and you've got transmission. Ticks we used to think take 2 or 3 days, and then, okay, now we can have some disease signs. We know now that it's up to 6 hours sometimes, so it can happen pretty quickly. And the signs aren't immediate, so that's the tricky thing as well, too, that most of what ticks transmit are this class of disease is called a rickettsial disease. And it's a bacteria that attacks either platelets or red blood cells, and it's slow. It's over a couple of days to weeks that this starts happening, and then your animal's not doing right, and you're kind of trying to put the pieces back together from the tick bite.
So let's talk about preventative measures that we can take in regards to your animals, but also in the environment in which they live.
Absolutely. So ticks are going to be in areas where there's brush, there's cover, there's woods. That's where ticks like. So you want to keep your yards clean. You absolutely want to get brush piles out of there where your animals are going to be. Wooded areas, you want to keep them out of wooded areas or protect them. And there's some great tick preventions out there. One of the ones that we like the most are there's orals now that are a pill that lasts for 3 months that gives you absolutely great tick coverage. There's collars, there's topicals, there's different things that work very, very well. But it's a serious disease, it really is, and it's such a silent thing that we just don't think about it that often.
And real quickly, talk about, we were saying, if you're protecting your pet, you're also protecting yourself, because this can be transmitted.
This is a big concern. So it's a zoonotic disease, and it's from tick. If your animal brings in a tick and that tick bites you, you can absolutely get the same things from these ticks. So it's a big deal. By protecting your animal, you're also protecting your family.
Definitely. We're going to have that information that you can protect your pets and also your family. Dr. Foret, thank you so much for joining us.
You bet.
And we